Hi, a very warm welcome to everyone joining our virtual information event this evening. I'm Alison Campbell. I'm Fertility's Group Director of Embryology, and I'll be hosting this event tonight. So what you can expect is about 40 minutes of videos, information, questions and answers. So we've got 3 short information videos throughout the evening about care fertility and our experienced team, and I'll walk you through the IVF treatment pathway from consultation to embryo transfer, and I'll show you some diagrams, some photos and videos as we go through, and then this will be interspersed with 2 Q&A sessions with myself and the amazing Professor Charles Kingsland. You can ask questions in the questions tab or else in the public chat. If you use the public chat, then everyone at this information event will be able to see just your first name, but you can also send questions via the email, which is events@carefertility.com. If we don't have time to answer your question this evening, then we will send a reply to your question via email. And if you think of any questions after the event, our patient events team will reply as soon as they can via the events@carefertility.com email. I'm very pleased to say as well that our new patient inquiry team are available until 8 o'clock this evening. So you can call them if you want to book to see us, or if you've got any further questions, it's 0800 564 2270. So let's start with a short video introducing you to care. And just a reminder, I'm really handy with a microscope and a pipette, but this is technology I'm not so familiar with, but I shall do my very best. I have done it before, so should be okay. You're in safe hands.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic. And even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Right, just move on to the next. Right, here we go. So I'm going to show you a few slides now just to walk you through the journey that most patients go through with us. I mean, as we heard in the short video there, fertility is a problem in the UK and around the world, and around 1 in 6 people do need help starting a family. And at Care Fertility, we genuinely do believe family is for everyone. We help lots of different patients with all sorts of treatments. So we're going to try and explain things quite generically, but please understand that everything is personalised and different treatments are available for different situations. So we're going to focus mostly on the general IVF process. This is a map of the UK where we have fertility clinics across the UK and in Dublin, and lots of satellite centres. So we are quite accessible wherever you may live. And it's really easy to get started with care. This is Shah, and we'll hear from her a little later on. We have a new patient inquiry team, and they're really friendly and knowledgeable, and they'll be available to answer your questions throughout the beginning while you're making your decisions about treatment and options. And we have members of the team, as I said before, available this evening till 8 o'clock. This is, Lauren, I think, is with us as well. This one's Shah, but Lauren is with us answering questions right now behind the scenes through the questions tab. Now, getting the right diagnosis and gathering information from you is really key so that we can start to give you the best advice straight away. We have a secure online patient portal, so all the information related to your treatment is held safely in that one place. If you have had previous treatments or test results, they can be easily uploaded to this portal, and there's often no need to repeat tests if they're quite recent. And all of this information is reviewed by one of our consultants prior to the consultation appointment. And this is George, he's one of our consultants from Care Sheffield. And in your initial consultation, your Care Fertility specialist will listen to your fertility plans and wishes and go through any existing test results you may have had. They'll explain any further tests that may be required, may be beneficial to help tailor treatment for you and understand your predicament. Your consultant will discuss the different treatment options available and the choices for you and the chance of success of each of those. So the intention is that when you go away from the consultation, you've got detailed information about treatment options for you so that you can consider in your own time. You'll know how and where to get support from our team and the cost of any treatments that we may have been discussing with you. So whether your diagnosis is simple or more complex, we have the depth of experience to give you your best chance at starting or growing your family. And I personally think one of the beauties of being part of this network of clinics is that we have that expertise across the whole group. So it's something quite particular, unusual to you, a rare case particularly, we can share our knowledge and experiences and make sure we do the very best for you. So after your consultation, the clinic teams are available to answer any further questions, and they'll send any other information that you may want through into your portal. Now, starting treatment, of course, everyone's treatment needs are different, and we pride ourselves in offering very individualised treatment. Our treatment offerings they start quite simple with intrauterine insemination, for example, and they progress through to quite technologically advanced, more complex treatments. So I'm just going to spend a few minutes walking you through the key stages of an IVF treatment. And most care patients need IVF, and much of this IVF journey that I'll talk you through applies to other treatments that we offer. So ovarian stimulation first, and this is Di from Care Tunbridge Wells. The first step of IVF treatment is ovarian stimulation. And this is where we prescribe medication to stimulate the ovaries to develop follicles from which we then go on to collect eggs. Now, everyone's issued with a medication protocol, which one of our expert nurses will explain to you. And they'll explain how to administer the drugs with a series of injections. It's not very nice looking at a photograph of a syringe, but they're really small. They look a bit big on my screen here today. So we offer online injection teach videos as well to remind you, so you can follow along in your own time at home. And the next thing is the monitoring. This is Rima from our Care Birmingham clinic. And we monitor the development of follicles using ultrasound scanning. And this monitoring phase usually lasts between 3 and 7 days, depending on the patient. And when we're happy with the number and the size of the follicles that are developing, we ask you to have a final trigger injection, which helps with the maturation of the eggs. It's how we want to find them in the lab at mature stage. So the maturation injection is normally in the evening, and your egg collection is scheduled for around 36 hours later. The egg collection is a straightforward procedure where we use ultrasound again to guide a fine needle to the follicles on the ovaries to carefully extract the eggs. It takes about 20 to 30 minutes, and it's usually followed by a short rest before you can go home. If you're using donor eggs, then we'd normally be thawing them around the time that the sperm is being prepared. Oh, I think I've got a video here. Let's show you the video. This is nice. Sperm. So the sperm sample is generally prepared around the time of the egg collection, and currently we have been minimising footfall in the lab, so sometimes we'd ask the sample to be brought in from home. And the sperm may have been previously frozen, or it could even be surgically recovered. It can be partner sperm, donor sperm, but however we have obtained the sperm, it's prepared in a very similar way, so that we concentrate the best sperm for the treatment. Okay, minimise that. We'll go back to the slides. Things like, I think that's it. Good. Doing well. So the next stage here, we have the fertilisation. Very important, and we can aim to fertilise the eggs with either IVF, in vitro fertilisation, or ICSI, which stands for intracytoplasmic sperm injection. So IVF is where we mix the eggs and sperm. We've prepared the sperm, we've washed the eggs, and we put them together and we leave them overnight. And ICSI is generally used when the sperm numbers or the sperm quality are low, and we select just a single sperm and inject it individually into each of the mature eggs that we've collected. So the method of fertilisation, whether it be IVF or ICSI, is usually decided in advance of the egg collection. But of course, our embryologists will check the eggs and the sperm on the day of the treatment to make sure everything's okay to go ahead as planned, and we can sometimes change the treatment type on the day, of course, explaining very clearly to you what's happening. So this is Lena, one of the embryologists at Care Nottingham. So we check for fertilisation the day after we've performed the IVF or the ICSI, and then we contact the patients with the news, hopefully good news. And more than 95% of our patients do get good news and confirmation of fertilisation. Now, following the fertilisation confirmation, embryos are left mostly undisturbed for several days in special culture medium in our electronically tagged uniquely identifiable dishes. And we aim to perform the embryo transfer at the blastocyst stage, usually just a single embryo. And this will be between days 4 and 6 after the egg collection. In most patients, they have several embryos to select from, and it's really important that we use the best possible methods to choose the best embryo first time. This photo of Alex is in our London laboratory, and she's looking at embryos developing in one of our time-lapse incubators. So I'm briefly going to talk about the 2 ways that we pride ourselves in embryo selection at Care Fertility. The first one is Care Maps. I think I've got a video for this. Let's see. Yes, there we go. So Care Maps is something unique to Care. It's the product of a decade of research and development, and we've used time-lapse imaging to monitor tens of thousands of embryos and compare the patterns of development between the ones that have been successful and resulted in a baby and the ones that we've transferred in good faith, but they haven't resulted in a baby. So we wanted to find out, is there something different about the development of these 2 groups of embryos? And there was. So we've developed an algorithm. It's a tool which tells us from a whole group of embryos which one has the best chance of implanting and becoming a baby. Just go back to the slides. There we go. So the other technology, which I'll just talk about briefly, is PGTA. So this picture on the right of the slide here shows an embryo being biopsied. So it's another technology. It's mainly used for women over 37 years. And because as women get older, their egg quality declines and the number of chromosomes in the eggs may be wrong. And this is called aneuploidy, and it can result in failure of the embryo to implant, miscarriage, or a child affected by an aneuploid condition. So our talented embryologists can remove just a few cells from the advanced stage embryo. This is the blastocyst that I mentioned before, and we send this off for testing. And the result is used to help us classify the embryos and again to select the best one for transfer. One which is euploid and has the correct number of copies of each chromosome. They're the ones that we want to transfer, and they will give the best chance of implantation and a baby. Now, PGTA is not offered to everyone, but if our consultants think you would benefit, then it will be discussed at consultation. We'll move on to embryo transfer. So it's a whistle-stop tour of IVF, but so irrespective of how or which embryo we've chosen, we'll use the same method for transferring it. So the embryologist loads the embryo into a soft, fine catheter, which is then inserted through the vagina into the cervix and the womb using ultrasound guidance, usually. And it only takes 10 or 15 minutes, and then you can go about your normal activities or have a rest afterwards, but there's no great need to rest, particularly after the embryo transfer. So the next is the two-week wait. So before you go home, I'm just jumping ahead of myself, before you go home after transfer, one of our care nurses will explain what happens next, and it's commonly called a 2-week wait before having a pregnancy test. And we generally provide progesterone medication just to support implantation during this stage of your treatment. And the pregnancy test is 14 to 16 days after the embryo transfer. And if it's positive, you'll come back to the clinic for a scan to look for a heartbeat a few weeks after that. And if it's negative, then we'll offer support, and we do have counselling available, and we'll also arrange for a follow-up consultation once you feel ready to discuss how the treatment had gone, what we could maybe do differently for the next time if you wanted to have a further treatment. So we move on to donation briefly. We've got a very large donation team and counselling specialists at Care. So we have everything in place should you need to use donor eggs, donor sperm, or donor embryos. And this donation team has over 25 years experience. been well established, and have helped more people start a family with the help of a donor than any other UK clinic actually. And we'll support you through the entire process, from initial questions through to helping to select the best donor for you. Just like to say a few words now about the support you will receive at CARE. We offer free counselling appointments, and we've introduced a CARE buddy programme to link you up with people undergoing treatment at a similar time to you if you wish. It's not for everybody, but some patients find this really, really helpful. We hold regular online support groups. They have been virtual, but starting to become face-to-face now, thankfully. We have a 24/7 CARE online forum, so you can chat with other patients, and all this with the continued support of the teams in the clinic. And we're here to help support you, not just medically and emotionally, but also financially. And we have a Care Pay, so this is exclusive to us, an individually tailored IVF funding package, different packages actually, designed to give patients the financial peace of mind of knowing that a plan's in place to fund treatment if it's necessary. So we created this following patient feedback. It's managed entirely by our in-house teams, so patients have a more seamless experience than, and their treatment's kept personal and private. So we've got 3 programs, all of which include the cycle monitoring, egg collection, all the embryology, and including the care maps that I talked about, the algorithm, also embryo transfer and freezing, and unlimited embryo transfers. So we're going to move on to our first Q&A session of this event. So just a reminder, we have our new patient inquiry team available until 8. If you wish to ask questions, you can use the chat or the questions tab, or you can email us. That's events@carefertility.com. So I'll minimize this, and hopefully, as if by magic,
Here I am.
here he is. Let me just shut that one off.
How are you, Dr. Campbell? My favourite scientific director.
Oh, so many of us.
So many of us.
Yeah.
Well, there's a lot of questions here, Alison. Shall I start rattling through them, and then we can discuss them as we go along? Is that the plan?
That's fine. Go ahead. Yeah.
Okay. So I'll try and answer as many questions that we've been as normal. We've been sent an awful lot. So here we go. I've been diagnosed with unexplained infertility, and I'm partway through the process. I had a scan yesterday, which was day 6 of ovarian stimulation. That means you've had 6 days of injections. And the ultrasonographer found 6 growing eggs and 10 that were still quite small. Is this normal? Well, first of all, unexplained infertility doesn't necessarily mean that there isn't anything there. It's just that we haven't found it, or the technology is such that we've not been able to discover that. But part of the IVF process can also be diagnostic as well as therapeutic. And it's not until you start the IVF process you see how your ovaries perform, and then at a later stage what your eggs look like and how the sperm and the eggs interact. So in many ways it's not only therapeutic, but it can also be diagnostic. So here you've had a scan, and the 6 growing eggs and 10 were still quite small. You can't see eggs on a scan. What you can see are the follicles. They're the little fluid-filled sacs in which the eggs grow. And we hope that we get at least 2 eggs from 3 follicles, something like that. There's not always an egg in each follicle, but the bigger the follicle, the more likely you are to find an egg. So you've got 6 eggs on day 6. I think that's fine. I think you're doing well. And the 10 are still quite small. Is that normal? Yes, it is. I think you're doing well. So the big day is day 9. After 9 days of injections, you'll have a better idea, and we'll have a better idea of when to do the egg collection, how mature your eggs are, and crucially, how many we might likely to get. So good luck. How do you decide what treatment to undergo specifically for polycystic ovarian syndrome and a low sperm count? Well, polycystic ovarian syndrome, we've talked many times on these webinars and Instagrams, but as a rule of thumb, and there are lots of other factors that come into play, but polycystic ovary is where you have lots of unruptured follicles, so you have potentially lots of eggs. So what we have to do is we have to tailor the stimulation for IVF so that you don't produce too many eggs, but we get as many eggs as we safely can that are all of the right maturity. Once we've collected them, if you have a low sperm count and we're not confident that the eggs will fertilize the sperm will fertilize the eggs by normal in vitro fertilization, then we do ICSI that Alison explained earlier. That's where we get one single egg, and inject a single sperm, a good-looking one, into the egg and help fertilization take place. So you cut out the middleman, if you like. You save all the energy for the fertilization process. So those are the sort of decisions that will be made, and of course during the consultation, when all these factors come to light, the consultant or the nurse practitioner will discuss all these things with you, so you have a clear idea of what's going to happen to you throughout your journey. And I think that's a crucial bit of information. You should be informed about what is happening to you. All decisions should be made with the help of yourself and the doctor and the nurses, so that you know what's going to happen. I have endometriosis. Will I need additional tests before starting treatment? Well, not really. If we know you've got endometriosis, you've probably been through gynecological treatment for that endometriosis, and you've arrived at the fertility unit now with the endometriosis. There's not an awful lot more we need to do. We need to measure your egg count, whether your eggs have possibly been damaged by the endometriosis that may have got onto your ovaries, and we'll see that with a scan. And so over and above that, there's not an awful lot else we need to do before that. So good luck with your IVF. Here's one for you, Ali. I have just seen the promo for Egg Safe AI. What does this do to the eggs, and what's it all about?
Right, well, we start with Egg Safe. It's something that we developed a few years ago now, and it's really a package to simplify egg freezing for women who are doing it for social reasons. They're not ready. It's a fertility preservation. They're not ready to start a family now. They're conscious of their fertility and they want that insurance. So we've recently added an AI, artificial intelligence, to this, which is really exciting. And what it does is we use image processing and artificial intelligence to look at images of the eggs just before we freeze them. And we've done a big study where we compared our expert embryologists with this artificial intelligence to see how well we could predict whether they would fertilize or make a baby. And unsurprisingly, I suppose, because this AI is built on a lot of information and data, it was better than the embryologists. And it's really difficult with eggs because they all look the same, and they are what they are. And what AI has given to us now with this Egg Safe or any egg freezing that we do at Care is extra information to help inform patients of their chance of success should they use those eggs in the future. So it just helps so much with decision making. Have I got enough? Have I given myself a good and realistic chance of success in the future if I decide to use my eggs? So they get a report with pictures of each egg and the estimated chance of each egg being successful in the future. So it's really special. It's not available anywhere else, and we're very proud of it.
Yeah, I'm always impressed in our care labs by the quality and the extent of the information, the data that we can use and extrapolate that from the laboratory and bring it into the clinic, particularly care maps, which I think is so useful for so many patients when it comes to assessing embryo quality and finding out which embryos are likely to turn into babies and which embryos aren't likely to turn into babies. It just gives you that so much more very, very valuable information.
Because time is so important, isn't it, Charles?
Yeah.
No, especially with female fertility, as the years go by, we heard before about the aneuploiding eggs. We need to choose the best embryo first time and get that shortest possible time to success. And I think that's certainly what our embryo selection techniques do offer.
Absolutely. So if you've got 3 or 4 embryos, you want to know which embryos are likely to turn into babies first or most quickly, or which ones aren't likely to turn into babies, because then you save time. And it brings that time to pregnancy so much earlier, and saves a lot of heartache. Here's one. When should I consider egg freezing? Well, I think increasingly all women should be thinking about the possibility of egg freezing. In the same way, egg freezing, I see it as a sort of an insurance on your fertility, in the same way as you buy home insurance, house insurance, pet insurance, car insurance. Well, you know, fertility insurance is also quite important. What you have to remember is that eggs are, women are egg warehouses. All your eggs are in your ovaries on the day you're born. You don't have the ability to make eggs. You don't have the ability to make them better. So as you get older, your egg quality deteriorates. And I see many women in their 40s who have delayed their families, or who have met Mr. Right relatively late on in life, who if they had frozen some eggs earlier, they wouldn't have, their fertility would have been spared. Now, this isn't true for everybody. There are exceptions, but nowadays the ability, we have the technology now to freeze eggs, and freeze eggs safely. This is a relatively new innovation, because 10-15 years ago that technology just wasn't there. We have it now, so why not, in certain circumstances, freeze your eggs, particularly if you want to delay your family, or sort of freeze time, if you like, so that when you get to 38, 40, and you may have lost a significant part of your natural fertility, then at least you can revert back to your eggs that have been frozen when you were, I don't know, 30, 32, 33. Wouldn't you agree, Ali?
Yeah, I know. I've got 3 daughters. They're not that age yet, they're teenagers, but they say to me, "Oh, why are you always talking about egg freezing when you meet young women?" But there's huge interest in it, and I think it's important that we increase awareness, and they make these choices if they want to.
Exactly.
Shall I just suggest, Charles, that you give us a bit of your expertise on preparing for treatment, because we've had a few questions from patients thinking about treatment and wondering what can they do to get in the best possible shape.
Yeah. Well, the most important thing that I believe is when you're preparing for fertility treatment, it's an emotional time. Not only have you got the emotion and the stress and the anxiety of difficulty in conceiving, but then you've got the added stress of the treatment. Now, the treatment itself actually is not that bad, but it's all the overlay, the emotion. So, preparation is very important. Weight. It's a great idea to try and get down to your boxing weight. So look at your body mass index. Now, your body mass index is your weight in kilograms divided by your height in meters squared. And the ideal fertility range is between 20 and 25. That doesn't mean to say you can't get pregnant when you're a higher body mass index, but that's the ideal. Certainly under 35 is better, because your fertility declines if your body mass index is below 20 or above 30, but over 35 it can be compromised. So my advice would be, try and get down to your boxing weight by eating healthily. Diet is is key, and Zita West has spoken with me on many occasions about dietary advice. Exercise. I see an awful lot of patients who come along and for some reason, just before they have their IVF, they move house or they change jobs. Well, those independent stress factors, try and clear your diary for for your IVF, so that you don't have additional stress factors. Obviously, if you have intercurrent disorders, medical disorders, thyroid trouble, for example, make sure that diabetes, make sure that all your other medical problems are stabilized, so that you're in the best possible medical condition. If you have reasons why the pregnancy might be complicated, so if we do get you pregnant, the pregnancy might be complicated, seek obstetric advice from a gynecologist, or we can do that for you as well. We can refer you into the right areas. Smoking, stop smoking, reduce your alcohol, don't cut it out. Life without alcohol, I couldn't imagine, but certainly reduce it down. And I think they're the main things. Is there anything else, Alison, that that I've missed out there?
Did you mention the hot baths?
Oh, for men, yes. Keep your testicles cool. Sperm like to be produced in the cool weather. That's why testicles hang outside the body and ovaries are inside. So no hot baths, boxer shorts. Men really, I mean, sometimes you see all these vitamins and minerals that you can take. Well, a lot of them can be counterproductive. Zinc is okay. Vitamin E you should be careful about, because too much vitamin E is not good for you. Certainly protein and additives, you know, for gym bunnies is not necessarily a good thing. You can be too fit, so don't get too fit, but there again, don't be just a couch potato. A moderate amount of exercise is good for sperm health.
Yeah, brilliant. Right, I think we should move to the next video, and then we'll come back and we'll try and talk about miscarriage and perhaps recurrent implantation failure, because there are lots of questions on that.
Okay.
So we've got a short video. It's Shah. I was just thinking it's Shah and Dave, like Chaz and Dave, but Shah and Dave. Shah's our new patient inquiry team leader, and she's going to be talking just briefly about how we support you through treatment. And then we've got Dave, who's Care's CEO. He's briefly going to describe life at Care Fertility and our dedication to supporting you. And then I'll come back and we'll have another 10 minutes or so of questions with Professor Kingsland.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of, well, one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, and they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you and, you know, fingers crossed, will give you that positive result from at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to care.
Oh, the support at care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
Okay, so we're back with Charles popping up any minute, I think, for some more Q&A. He's so good with the questions and answers. It's difficult because there are so many questions coming in, and a lot of them are hard to, just saying it's hard to answer some of the questions when it's asking about particularly about results, individual results, or costs for particular treatments. So it is hard to answer. We can't really answer generically about an individual case, but hopefully you're getting the answers, more personalised answers through the questions in the chat function, and we're keeping the information flowing a bit more generally. So we were going to talk about miscarriage, Charles.
Yeah, yeah. Miscarriage is it can be a devastating event in your, particularly if you've been trying for a baby for a long time, and of course IVF doesn't prevent you from miscarrying. Not that the miscarriage rate is any higher, but it's still a complication. And 1 in 5 naturally conceived pregnancies and IVF pregnancies will end in a miscarriage. And we normally say that before you investigate miscarriage, if there's a 1 in 5 chance, to have 2 on the trot is 1 in 25, which is still a possibility. But to have 3 on the trot, 1 in 5 times 5 times 5, that chance is 1 in 125. So traditionally, we would investigate the possibility of another cause of a maternal cause of the miscarriage after 3 consecutive miscarriages. But of course, we recognise that can be too much, just too much for individuals, in which case you might want to be investigated much earlier. It's still, the vast majority of miscarriages are generated by the baby themselves. We always have this idea that when you miscarry, there's a tiny little well-formed baby hanging on saying, please mummy, please don't let me fall out. Well, nothing can be further than the truth, because the vast majority of babies that are miscarried are non-viable and are in effect expelled, and there's very little that you can do about that. However, if you do have recurrent implantation failure or a history of miscarriage, there are things that we can do. For example, we can biopsy embryos to see whether they're genetically normal or not. And of course, if the embryo is genetically normal, there's a much lower chance that you will miscarry. The older you get, the more abnormal percentage of embryos. So that when you're 40, 75% of embryos will be genetically abnormal, and there's nothing you can do about that. Whereas if you're 25, then the number of abnormal embryos is much, much lower. So if you do have a history of miscarriage, then PGTA, which is a biopsy of the embryo, can be of help to you in preventing further miscarriage. However, what we also recognize is in a small number of women, or small number of couples, it may be a sperm problem, because of course sperm are involved in the creation of the baby. So we mustn't forget that. And increasingly we're finding more and more evidence to suggest that sperm may be implicated in miscarriage. And also there may be a maternal cause. There may be something in the mother that's just not accepting the pregnancy. And there are many tests that we can do to exclude those problems. Or if there are problems, we can treat them at an early stage and treat them very effectively. So the outlook for miscarriage is good. We can't turn back the clock. We can't turn your age back, but there are lots of things we can do. Just on that, Ali, is there anything you want to say about sperm tests and miscarriage? Because I find this area really fascinating and increasingly important.
Yeah, well, I was thinking just to say a few words generally about our toolkit and our investigations. And there are so many options, but I feel confident that we've got these tests available and these solutions quite literally available for patients depending on what the situation is. So we do have an important sperm test that looks at the level of oxidative stress on the sperm membranes. Really easy to do. We can do it as part of a routine semen analysis. It's not very expensive, but it gives us information, because if the oxidative stress levels are high, this can mean that it will cause problems for the sperm, which then can cause problems with fertilisation and embryo development downstream. We've also got an enhanced culture medium. So every patient's embryos and eggs and sperm are washed and prepared in specialised culture medium. But then we've got one that we use, and there's a lot of data published about it, and we've got our own experience and data with it, which points to it being very successful, particularly for patients that have suffered from miscarriage or recurrent implantation failure. So it's enhanced with a natural cytokine. It's like a growth factor, and that you find naturally in the female tract at very high levels during implantation. So that medium is enhanced, and it seems to have a really positive effect on embryos for those types of cases. So I hope that's not too complicated.
One thing that we have discovered as well, when couples are trying for a baby, the easy thing to do is to nip down to the chemist and buy some vitamins and minerals for well man or well dad or well bloke or whatever they want to call them. But these could be counterproductive. If you don't need that medication, classic example is vitamin E, don't take it, because that can have a detrimental effect on the sperm. Is that right, Alison?
Yeah, and I think it's quite common to take antioxidants with sperm. People read about it and they think, oh, I need antioxidants. But then we can get the opposite effect, and we get a reductive stress. You might remember from O-level GCSE chemistry. So it's important not to take things just because you've read about it. And it's difficult to say that, because you want to do everything you can to help and give you the best chance. But you definitely need to speak to the experts and do the right thing to prepare and during your treatment as well.
Can I just mention this quickly? I've just had a laparoscopy surgery for 2 ovarian cysts that have been removed. When is best for me to start IVF? Well, if you've had them done laparoscopically, my advice would be is speak to your surgeon, because he will obviously, or she will have obviously have a better knowledge of what's gone on, but if and what the recovery time is. But generally speaking, if you've had a laparoscopic ovarian cystectomy, you should be ready for IVF when, well, first of all, when you're up to it, when you feel like it, but you'll have made a good recovery, or your ovaries have made a good recovery after about 3 cycles, and that's when you should be starting thinking about seeing your fertility doctor and getting things up and running.
Right, I think we need to start tying this up because we've already run over. Not as
Surprise.
Not as much as you did with Dr. Amy Barry last time. I think it was a really long session, but
I believe so. Yeah, it turned into a bit of a marathon, that.
Yeah, but I can see that the team behind the scenes have been really busy answering questions. We've got another short video before we come back and say goodbye. So I'll just pop that up now.
One in 6 people need help to grow their family. You're not alone. And our care family will do everything we can to help your dream of family come true. There are over 50,000 care babies in the world today, and behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.
Okay, so that's the end of the session for this evening. I hope you found it informative. We will get back to you with answers to all of your questions, and don't forget the inquiry team are available this evening if you need them. Any final words from you, Charles?
No, just thank you for watching. And as I say, we'll the girls are still, Lauren is still working hard here answering questions. So we'll get back to you, as many people as possible, after the event with answers to your questions. And for those of you undergoing fertility treatment, good luck. Good luck.
Thank you.